presentation over West Nile virus, and this is my audience. Alright, some background information. West Nile was first isolated in 1937 from a woman in the West Nile district in Uganda, which is in the central region of Africa. In 1999, the West Nile virus was identified for the first time in the United States in New York City. It is thought that the virus was introduced to the United States via migrating infected birds and subsequently transmitted to humans through the bites of infected mosquitoes. The West Nile virus is a versatile virus capable of infecting a wide range of cells and diverse hosts, including birds, reptiles, and various mammals, including humans. Between 1999 and 2004, 16,000 West Nile virus disease cases and over 660 deaths were reported in the United States. Fortunately, 80% of people who have been bitten by an infected mosquito will not develop any symptoms. The structure of West Nile virus is a small, spherical, enveloped, single-stranded RNA virus approximately 50 nanometers in diameter. The RNA encodes the capsid, envelope, and pre-membrane proteins and 7 non-structural proteins that may have a role in viral replication. And here is my picture. How does one get infected? The virus is introduced through a puncture in the skin, and the virus is carried through the lymphatic system and bloodstream to the spleen and kidneys. If the virus crosses the blood-brain barrier into the central nervous system, the result is inflammation of the medulla, brainstem, and spinal cord, causing severe illness. Mosquito bites are the most common means of transmission of West Nile virus, but other means of human transmission include blood transfusion and solid organ transplants, since it goes through the bloodstream to spread. The West Nile virus usually has a 2 to 6 day incubation period, but may range between 2 to 14 days. In immunocompromised individuals, incubation could be up to 21 days. So some populations at risk are people over 60 years old, people with comorbidities such as diabetes, kidney disease, cancer, and hypertension, people with low socioeconomic status, homeless individuals, organ recipients, outdoor workers, but everyone can get West Nile virus. All right, some symptoms. According to the CDC, 1 in 5 people infected with West Nile virus will develop a fever or other symptoms. Acute systemic symptoms include headache, body ache, fever, vomiting, diarrhea, and rash. According to Redbook, less than 1% of infected people will develop severe meningitis or encephalitis. More severe symptoms include high fever, neck stiffness, stupor, disorientation, coma, Parkinson-like tremors, convulsion, muscle weakness, vision loss, numbness, and paralysis. 1 in 750 human infections will involve the central nervous system, resulting in meningitis or encephalitis, which may be fatal. Less than 1% of infected people will develop severe meningitis or encephalitis. West Nile virus has the same presentation as viral meningitis. For treatment, unfortunately, no specific therapy is available for treating or preventing West Nile virus, but antiviral compounds, therapeutic antibodies, and vaccines are in development, but none are currently licensed for human use. Some supportive treatments include over-the-counter pain medication, such as ibuprofen or acetaminophen, rest, and fluids. Hospitalization may be required for severe cases where IV therapy for dehydration due to vomiting and diarrhea is administered, and IV pain medication for headache and body aches if the over-the-counter medication does not do the job. For prevention, you can apply insect repellent when outside, avoid peak mosquito hours, which is at dawn and dusk, so sunrise and sunset. Wear long sleeves, long pants, and socks outside to reduce the amount of skin showing. And mosquito proofing your home by draining standing water and installing or repairing screens on windows. For the community prevention mosquito control program, which includes neighborhood spraying of insecticides, removal of public containers of standing water, and removal of old tires since they attract mosquitoes. Living in Texas, we all have bad experiences with mosquitoes, and we are all at risk of contracting West Nile virus. Although there are no treatments approved for humans, researchers are actively developing therapies and preventative vaccines to combat the virus. Until improved, the best defense against West Nile virus is prevention of mosquito bites. Alright, that's the end of my presentation. Thank y'all for watching. I'm excited to watch all y'all's. Goodbye.